One of the most important aspects of functional medicine is the philosophy that instead of focusing primarily on symptoms, it focuses primarily on the root cause of an illness or of the symptoms. And to be able to use a myriad of different tools, both diagnostic and then treatment tools as well, that are sometimes a little bit outside the scope of conventional medicine. As far as who makes an ideal patient or an ideal client for functional medicine, I can't think of anybody who is not an ideal patient or an ideal client outside of, very pressing emergent situations. If I were to think about what makes our clinic, ProHealth, different from other functional medicine clinics, and there's a lot of good ones out there, we don't do things through insurance. Which sounds a little scary at first, but they realize the benefit far outweighs the added cost in terms of how much time they get to see the provider, in terms of the type of lab work and type of diagnostic tests that are able to be done, then the type of treatment modalities as well. Things that insurance sometimes will not cover, often will not cover, or allow for, so they can't be done in conventional medicine, very rarely are, but things that are very effective. Our background is very much with physical health in respect to lifestyle. My wife and I also own and run a physical training, personal training gym that focuses on nutrition. We are just very familiar and comfortable with the other aspects of what really brings health to a person outside of just the clinical medicine aspect of it. As a new patient coming into our clinic, one of the big things that you can expect, and one of the big things that you'll see that's very different, is the individualized attention. When you're coming in, you won't see a waiting room with 20 people. We try to schedule you so that you get here, you get in to see myself within 5-10 minutes at the most. So very little wait time. And then once we do sit down with you, it's not unusual at all to spend an hour together, really going through, well, basically everything about what could be, benefiting you, hurting you, and what kind of things we need to do and look at.